Hello, welcome back to the secrets of what you always wanted to know and never dared to ask. In this series we are talking about pelvic girdle complaints. This second episode is about the question, how should you deal with these pelvic girdle complaints? Women and men with pelvic girdle pain can have very different complaints. But what you almost always see is that their physical capacity is significantly reduced. This can be a problem in treatment, because how do you deal with these problems? Several distinct treatment techniques are used for pelvic girdle complaints. Instead of dealing with symptoms, such as pain and stiffness, it is better to tackle the cause of the complaints. But what do we exactly mean by this? In the previous clip, we showed that pelvic patients are often in a vicious circle of impaired control over the pelvic joints and overload. If you want to tackle pelvic girdle complaints effectively, you will have to break this circle. And how do you do that? The first thing to realize is that your pelvic complaints usually do not solve in one procedure. Pelvic girdle complaints are like a puzzle with different pieces that you have to put together in the right way to get the whole picture and be able to treat your patient effectively. Which pieces of the puzzle are we talking about? There are several very distinct steps that you have to take into account. In the first place, someone with persistent pelvic complaints needs to relax his excessive working muscles. And to prevent overloading, the patient needs to balance his daily load and capacity, which is also a piece of the puzzle. And sometimes the pelvic joints need some extra attention, as for example with the Domino self-mobilization exercises. Then, at low loads, the basic muscle control can be trained. And after that, endurance, coordination and strength training can be expanded. It is of utmost importance that these steps are applied in the right order and at the right time. All elements of the treatment, such as relaxation, load and capacity, basic muscle control and so on, are interdependent. If they are deployed in the right order and at the right time, the train will run properly and recovery will set in. However, if these elements are used incorrectly or even skipped, the train will falter and the results will be limited, or there won't be even a result at all. Another important aspect is the level of training. Most pelvic girdle patients need to start at a low level in order to build up. If the training is too heavy or progress too steep, this may lead to a counterproductive effect. The last important element is behavioral change. Pelvic patients can only break their vicious circle if they change their pattern of behavior. This implies that as a practitioner, you need to consider whether your treatment strategy sufficiently meets the needs of the patient. Are you a talker, a hugger, an explainer, a doer, a trainer or a bully? Most of all, you have to be aware of what the patient needs. So the key message is, if you treat people with pelvic girdle complaints, pay particular attention to the order of the steps, correct structure of the exercises, and whether the patient behavior is what has been agreed upon. You can then have a good result with many patients, even within already 4 weeks. If this does not work out, keep in mind that the puzzle in this particular patient may be more complex than expected. Okay, this treatment structure is clear, but how heavy or intense can you train people with pelvic girdle complaints? We're going to talk about that in the next clip. Until next time.